So please focus with me. I'm going to talk about the stomach stent or the gastric stent. And actually, the gastric or the stomach stent is a mesh wire or wire mesh or some plastic thing that is used to as a temporal or a palliative solution for gastric outlet obstruction. Okay, so if you have an obstruction in the entry of the stomach, in the cardia between the esophagus and the stomach, for example, or in the pylorus of the stomach, or in the second or the third part of the stomach, you can overcome this with the gastric stent, which is something that is temporary or palliative. Okay, so it is not the definite solution of anything. It's either temporary or palliative solution. Okay, so here you can see that stent, and actually it can be inserted by the radiologist or by the endoscopist. Okay, by using or not using the x-ray fluoroscopy. Now, how to introduce that gastric stent? Okay, so first of all, you have to put an endoscope here. Okay, and a guide wire is inserted through this stenosis, along the stenosis, and after that the stent material or this tube with the stent is inserted. The endoscope is withdrawn, and we can use an x-ray to elaborate the area more. Okay, then the stent is expanded, the guide wire and the endoscope is to be removed. So now, what about the risks of using the gastric stent? As any endoscopy, you have a risk of bleeding, of perforation, of pain, and now you have a stent there. There is no obstruction. The pylorus is not applying its function, obstructing the stomach when there is no food insertion into the duodenum. So you have a continuous you may have a continuous reflux from the stomach into the esophagus and so on. Okay, and that may lead to heart pain, which is overcome by the antacids, the proton pump inhibitors. This is about the early risks of insertion of the stent. What about the late risk? Actually, the late risk is about that the stent can move. Okay, so the only way to prevent the motion of this stent downward is by the growing tumor. Okay, the growing tumor will push that stent. Okay, and will prevent it from motion. Okay, this is so the motion of the stent downward is the first late risk of the stent. The second thing is that the growing tumor may obstruct this stent. Okay, it may push from this side and push from this side and obstruct, or a bolus of food may come and obstruct this stent, and in this case you will need an endoscopy to remove that bolus of food, or to deal with the tumor obstruction or growing, or that obstructed the stent. Actually, special diet should be eaten when you have a stent in your stomach. Uh, you have to avoid as much as possible the solid food. The liquefied food is preferred, and the soft food, of course, is preferred. Okay, and try to drink between each food bolus and food bolus. Okay, so this is briefly what is a stent, stomach stent. Okay, and remember always, it's a temporal or a palliative care thing. Okay, it's not a permanent thing to deal. Okay, so thank you very much. See you in another video.